Hello, everyone. I'm Rose Gerber, Co-as Director of Patient Advocacy and Education. Thank you for joining us today. March is Colorectal Cancer Month. What may surprise many of you is colorectal cancer is the second leading cause of cancer death in the United States, only behind lung cancer. And I know, even though I work in oncology, I was a little bit surprised to be reminded of this very important fact. When we read cancer statistics, because the numbers are often so large, it can be very easy to forget the personal experience that the individuals receiving a cancer diagnosis are going through. Our guest today will remind us about the importance of remembering the patient experience. In my professional role and in my personal life, I've had the opportunity to meet so many incredible cancer survivors and leaders of national advocacy organizations. And in that group, Trevor Maxwell really stands out. In fact, when I invited him to this chat, I had to tell him, I hope you don't think this is weird, but I've been following you for a long time because his story is so incredible and the work that he's doing is so incredible. Following his diagnosis of colon cancer in 2018 at a young age, Trevor, a former journalist who was living a very active lifestyle and also very busy as a husband and father, became very depressed during this time. What I found extra remarkable is during his active treatment, he formed an organization called Man Up to Cancer as a way to help other men struggling with mental health during cancer treatment. So today, in addition to Trevor sharing his personal story, he's going to provide us with important information on colorectal cancer and also give us insight on resources and great information about his organization. Trevor, welcome. We are so happy to have you with us today.
Hey, Rose, so happy to be with you. It's a real honor to be with you today and your guests. So yeah, thank you for having me. And I also just want to say on the outset, thank you to all of the providers, the practitioners, like everyone within your organization who is working hard every day on behalf of people like me and families like mine. And a shout out at the top of the show to my local community oncology practice, New England Cancer Specialists here in Maine, Dr. Devin Evans, the entire nursing crew, every other staff there. They have provided compassion and high quality care for the 6 years that I've been in this cancer fight, and I wouldn't be here without them.
Thank you, Trevor.
So yeah, so just an introduction before I'm going to share some slides. As Rose said, I've been living with stage 4 colon cancer for 6 years this month. Diagnosed at age 41 in March of 2018, when like if someone had quizzed me on anatomy, I probably wouldn't have been able to tell you that my colon is my large intestine, and all of a sudden thrust into the world of surviving with a terminal prognosis. I just had my 7th major open abdominal surgery in November of 23 with the amazing team under surgeon Dr. James Cusack at Mass General Hospital in Boston. That's another amazing thing about my local oncology practice is the relationships and the connections that I've had to NCI centers, including MGH, Johns Hopkins, UCSD, and others. So that has been the physical journey, along with more than 50 rounds of chemotherapy and immunotherapy. And like you said, Rose, from the emotional standpoint, all of those surgeries and chemo and everything else has been very, very difficult. But as a relatively young man with a wife and 2 young children, it was crushing. And I really did go through the depth and really rock bottom when it came to my mental health going through cancer. And I'll get into that more later, but I'd love to share some of the images with your folks who are on the call today from my journey, if we could pull that up.
Thank you. And just
Got one more thing to get to first.
Yes, I apologize. See, this is proof about my credibility. I said I was so excited to have Trevor start sharing his story that I forgot to show this important slide. Just a reminder, we are planning to go to Capitol Hill in Washington, D.C. on May 8th. And as you see from the asterisk at the very bottom, we'll have more information later with what states we're targeting and what specific criteria we'll be looking for the advocates that will attend with us. And it's not just patients, it's all members of the cancer care team. Okay, now on to Trevor's slides.
So, I'd like to introduce you to my family. So this is, you might think these are my three daughters, but the one on my left is actually my wife, Sarah. Um, she's my high school sweetheart. We've been dating, with a little break, couple breaks here and there, but for 30 years, more than 30 years, when we were in high school in Maine together. And on the far left is our 16-year-old Elsie, and on the far right is our 18-year-old Sage. And Sage is now a freshman at the University of New Hampshire studying speech therapy. And Elsie is a junior in high school. And this semester, she's actually studying abroad at a leadership program in Johannesburg, South Africa,
Oh, that's sweet.
which is just, and so just amazing, resilient kids who have gone through a lot. They were 12 and 10 when I was diagnosed with what we originally thought at the time was stage 3, but we learned like 3 months later that it was stage 4, with metastasis to the liver. And then since that time I've developed metastatic disease throughout my abdomen, the peritoneum. Right now I'm currently cancer free in my liver and lungs, but playing whack-a-mole with nodules in my peritoneum. So this is what I live for. We can go to the next slide. Just a shot from this is from my second liver resection. That was early 2019. We can go to the next one. This is when the Dempsey Challenge, I'm involved with the Dempsey Center here in Maine, incredible resource. And when they had their challenge, I was in the hospital for another surgery, so I participated virtually. That was my bib. We can go to the next. So I've had this midline incision 4 times now. This was actually before my last surgery. My current incision extends down past my belly button, several inches. So this is just, I like to share this with people because, like Rose said, sometimes we can get caught up in the statistics, and this is a really powerful image to really show like the physical impact that, we go through as stage 4 colorectal cancer patients and other types of cancer. We can go to the next. This is Leah and Laura, and I'm not going to get all the names, but the nursing crew at New England Cancer Specialists. This was back in probably 2019 or so, just showing some love for them. And we can go to the next one. This is from when I really started speaking up and speaking out and getting the Man Up to Cancer mission going, a local news report. And we can go to the next. Excuse me. I had the honor of speaking at last year. I couldn't go to this year's Call on Congress, which was a Hill Day that finished up yesterday, organized by Fight Colorectal Cancer. But I had the chance to go to DC last year and speak at the United in Blue rally. And these are some of our leaders in Man Up to Cancer behind me from left to right: Joe Bullock, Yuli Alexander, and Michael Holtz, getting up to really talk about getting more men involved in advocacy. And we can go to the next. And this is a bird's eye shot. Shout out to Jesse Dillon, who brought his drone to our in-person men's cancer retreat, the Gathering of Wolves. This was our second retreat. So this was September 2023 in the woods near Buffalo. So just get a bunch of guys facing all types of cancer out in the woods to have an actual retreat was a pretty special experience. And this captures the full camp. I'll talk about that as well in a bit. You can go to the next. So this is my contact information. Please feel free to reach out. Check out our website, manuptocancer.org. You can reach out to me anytime, Trevor at manuptocancer.org, after we're finished with this presentation. And no matter when you're seeing this, would love to hear from you.
And so don't think it's over, anyone. No, we're going to, let's keep this on here just so you can people can have your contact information. So Trevor, there was an excellent article that I read about you in Cancer Magazine today, which I believe was the AACR publication. And I thought it gave a really good overview of your story. So again, if you can just kind of take us into a little bit more detail about what you went through, because I think being so open about your depression was incredible, because a lot of times, as any other cancer patient will know out there, is sometimes we try to minimize what we're feeling, and you were so open about it. So if you can talk to us about that, please.
Yeah, absolutely. So Um, Before diagnosis, I was just in the middle of my life. I was a longtime journalist, and then after that, I was doing communications and public relations. I had my own business, just working for myself, and my wife is a teacher, and our kids were just growing up. We're here on the coast of Maine, and um, it was just a normal life, really. And then in that winter of 2020, going into 21, um, is when I really start. I'm sorry, I get all my dates mixed
That's okay. Go
up.
ahead.
I got to go back further than that. It was the winter of 2017 going into 2018. You can tell I've been doing this a while. And I started noticing fatigue, abnormal fatigue, to the point where I would get up and start my day and then have to go back to bed or just rest. And I just chalked it up to midlife and possibly some mental health because, like millions of Americans, I have faced some depression and anxiety just in normal life. And so I thought it was just mental health plus just getting older and having a busy life and busy kids and everything else. But it just continued to persist and got worse, to the point where when I'd climb a flight of stairs, I could just feel my heart beating really hard. And it was really unusual for me because I've always been a physical person, always been one to exercise and you know, climbing stairs should not be an issue for me. So finally, I reached out to my primary care physician, and I was otherwise healthy, 40 years old, or 41 years old, no other real big health issues. And I wasn't doing physicals. I hadn't gone to a doctor in a while, and reached out to my primary care physician, and I got that call that you never want to get, which is like a message after hours on Friday. And she said, call me back as soon as you can. There's some odd things with your blood work. We really need to talk. And turns out that I was iron deficient anemic. Um, Basically, I didn't need a transfusion, but I was pretty close. I had basically no iron in my bloodstream. That was what was causing the fatigue. So for a healthy person like me who didn't have any bleeding, usually that's from the GI tract. So that next week, she got me in for a colonoscopy, and still, like, cancer was not on the radar. um, we thought maybe polyps or hemorrhoids or even like some other cause. But I had the colonoscopy, and afterwards, the doctor, my wife and I went in, and they waited for me to basically um, come out of the haze, and sat down with the doctor, and he said, you have a fairly large mass, about 9 or 10 centimeters, in your ascending colon, and we're going to need to refer you to surgical oncology, and like you need to speak with them as soon as possible. And that was the moment that everything changed for me and my family. Like, I was cruising through life, and then I was a cancer patient. Um, and it was just I like to describe it as a life asteroid because it just hits, your whole family and friend group and just explodes. Nothing has been the same since that point, for better and for worse. But that was 6 years ago, and we had to go tell our family and our friends and tell our children that I had cancer, which was one of the most difficult things, parents can ever do. Um, so that was really the diagnosis story. And from then I was just thrust into this fire hose of information phase, and you need surgery and you need chemo and you need this and that. And you're trying to learn about this disease that you had no frame of reference for at a relatively young age. Um, so that really is there. Did you have any other questions specifically around sort of my story?
Yeah, I just really just a comment. I'm sure you're expressing it now, and I can imagine what it felt like, just the utter despair and just probably wanting
Oh,
to
right.
pass, right? When you get that. In that moment, you and your wife were there. In the immediate aftermath, did
Yep.
you freeze? Did you said you talked about your family, but that's a really, really tough space because you're thinking about yourself, but I know that you're automatically thinking about your wife and your children.
Absolutely. And I would say it is real, like, physiological shock.
Yeah.
The phases for me were just shock at the beginning. And then, like, I remember Sarah and I just crying all night, like for nights at a time, just talking about how young our kids were and like who gets colon cancer at age 41 and how has this happened? And it was just devastating. And then after the shock, I really went into a spiral with my mental health. Started experiencing intense anxiety, intense depression, to the point where I was worried about being hospitalized or almost was hospitalized for my mental health,
Mm.
outside of what I was going through physically with my cancer. It was just crushing. When you look, of course, I'm a journalist. I dove into the research and you find out right away that the overall survival for stage 4 colorectal cancer at 5 years is still less than 15%. And I just didn't know how to deal with that. I went into a very dark place. I disengaged. I isolated myself from everyone, including my family. I felt like a burden. I felt shame. I felt ashamed, like somehow I had caused this, and now I was spiraling with my mental health. So on top of having cancer, I felt like I wasn't responding to it the way you should, right? Like I would see in popular culture, like the images of men facing cancer are usually like what I like to call as toxic positivity. It's that everyone's working full time while going through chemo and running 5Ks and raising money and all that stuff. And here I was broken, um, on my bed, on the couch, like really in a place that I didn't think I was ever going to come out of. And at the time I didn't. Um, but fortunately, I had my wife and my kids and my community who wouldn't let me just walk off into the woods and disappear. Like they had to, when I was at my rock bottom, they had to fight for me
Mm.
and they had to lift me up and carry me through that part. And they did, especially my wife, Sarah. Um, I remember distinctly a conversation we had around Christmas time of 2018 when I was struggling so bad. And I just said to her, I'm just so afraid that the girls are just going to remember me as sick, going through chemo, going through surgery. And they're young at that point.
Yeah.
And she said something that I put in my book and everywhere else. I talk about this all the time. This was really what I needed to hear. She looked at me and she said, I'm not worried they're going to remember you as sick. I'm worried they're going to remember you as sad, because I'm not a sad person. I'm a social person and engaged and always helping others and outgoing. And cancer had really taken me into a dark internal place. And I remember telling her, I can't dig out of this pit overnight. I it's going to take time, but no matter if I live another year or another 20 years, I'm going to do something every day that will get me back out of this mental health place and be the dad that I want to be to our daughters and be the husband I want to be to you. And it did take a while, but that was really the turning point in my cancer journey, was to say I needed help. And I have people around me to encourage that, because I needed help to get me out of where I was. And once I started reaching out for help, I found a counselor, Patty, at the Dempsey Center. I found a group at the Dempsey Center, group therapy. I found or group support. I found people in Town, which is an amazing peer-to-peer support network online on Facebook. I found other people my age, shockingly, many of them
Mm.
who were going through this. And I started just to feel less alone. And I started feeling empowered. And it was through admitting I needed help and getting the help, especially from the emotional side. Like I was fine going through all the physical stuff. It was the emotional side. And so into 2019 and then summer 2019, fall of 2019, my cancer has been persistent this entire time. I have not really had much breaks. Um, but my emotional, my ability to be the dad I wanted to be and to be the husband I wanted to be started coming back to where I wanted, right? And thank God, because I just love my family so much. And to have gone to where I went emotionally, and now to have, and I still have my ups and downs, believe me, like I still struggle. I still have some anxiety and some depression, but it's not persistent. It's not clinical. I don't dwell there. It's normal, right? you can't go through 6 years of metastatic cancer and everything I've gone through without having some emotional troubles. But that's appropriate and normal.
Yes.
What's not appropriate and normal is like completely being checked out and not being able to function. Um, so yeah, that was really my emotional journey, and that provided the origin and the genesis for starting Man Up to Cancer.
Uh, Trevor, you mentioned something, you mentioned the word toxic positivity, and I love the words that you put on that, because for cancer survivors, so many cancer survivors face that. They don't face what you've gone through, what you're currently going through is just incredible. We're also grateful that you're sharing this personal journey with us. But yeah, so many times it's like you have to run a marathon, or you have to all of a sudden, start checking everything off your bucket list, and you have to almost morph into someone you may not be. And as a cancer patient, especially someone diagnosed with your stage, it's okay, as you're saying, just to like collapse on the floor and not want to engage with people, because you have changed completely. And I think this is why you're so impactful in the national space, because you're saying things out loud that a lot of people might feel but don't express.
Yeah, I feel like there's just such an unrealistic expectation on patients and survivors to be those models of strength and positivity. And that doesn't allow us the space to experience all of the emotions that come with us, even the really hard ones. And so a lot of cancer patients and survivors, especially if they're out, in the public eye or they're sharing their story, they feel like they have to put on this mask, like, well, I can't share all of it
Yeah.
because people don't want to hear that. They don't want to hear that I was lying on the floor of my kid's bedroom, clutching a t-shirt from each one of them, crying for days because I thought I was going to die and leave them. Like, that's my truth. And the truth is, so many people go through those emotions, that, we have to normalize that. We have to normalize saying, like, you know what, like, it's okay to not be okay. We shouldn't feel this burden to put on this happy face for everyone. And so really part of the goal of me starting Man Up to Cancer was to show it all. Like, on my podcast, on my blog, whatever I do, I'm showing all of this. And because I felt like, especially for men, there wasn't anyone normalizing that. Like, there wasn't anyone saying, it's okay to share it all. Not only is it okay to share it all, it's healthy for you.
Mhm.
And it's also healthy for you to experience all those emotions. Like, people get down on themselves in our space for feeling negative or having dark thoughts, or just for the way they think.
Right.
That is not helpful, and it's not healthy.
Right. And, something that you mentioned earlier, the story about you clutching the t-shirts of your young kids, and your kids in my mind are still young.
Yeah.
You were young. You are young. You're 41 when you're diagnosed. What is happening with the colorectal statistics? Because you're stunned with the cancer diagnosis, but it seems even magnified because of your age and the stage of life that you're at. So can you tell us about that as well?
Yeah, and thanks for saying that at the top about CRC. So I'm going to say CRC for colorectal cancer,
Mhm.
for that being the second leading cause of cancer death overall. Um, so we know that colorectal cancer is stable or declining in older Americans, so like 50 and up, because of our increase in screening rates.
Mhm.
And that's a fantastic thing. But we also know that CRC is disturbingly on the rise for
Mhm.
people under 50, multiple percentage points a year.
Wow.
Um, so right now, CRC has become the leading cause of death, the leading cause of cancer death for men under 50.
Oh my gosh.
And it's the second leading cause of cancer death for women under 50. So I
Mhm.
think, but it just hasn't gotten the awareness, right? Like, it's uncomfortable dinner conversation for people to talk about colons and rectums and poop and all that stuff, but we should be shocked by that. We should, the leading cause of cancer death for men under 50, second leading cause of cancer death for women under 50. That should slap people in the face. And the thing is that we don't know why. So the question that's not getting enough attention in our society is, why is this happening? There's The scientific community throws out ideas, is it, environmental exposures, the food, the a number of different factors, but the truth is there is no scientific consensus.
Mm.
We don't know why. We throw a lot of money into awareness. We throw a lot of money into treatment, but we're not throwing a lot of money into answering that question. Why are younger people getting diagnosed at a far higher rate than they were with CRC? And to me, that's the question we need to answer. And I've met or been in contact with literally thousands of early onset CRC people, many of whom have no red flags. They are healthy people, grew up healthy, eating good food, and they're getting diagnosed in their 20s, 30s, 40s with CRC. And the problem is, and I'm sure that your practitioners see this at the community level, is that this awareness has been a little late in coming.
Yeah.
Meaning so many of these people are going into their PCPs and complaining of blood in the stool or symptoms, and they're being turned away. They're being misdiagnosed. They are being ignored. And then they come back 6 months later, a year later with worsening symptoms. They finally go see a GI or they get a colonoscopy, and they have much higher rates of being diagnosed at stage 4 because their symptoms were ignored. So this is huge for awareness, is we have to understand at the primary care setting and obviously at the community setting with the oncology that it is not rare anymore for a younger person to be diagnosed with CRC, even without the traditional red flags.
And that's why your
Yeah.
advocacy is so important, Trevor. It is really, really important because the saying goes, we don't know what we don't know. And I think the point that you make about the uncomfortable part of the symptoms, that I think that's really true. And I don't know how you get over that. That's a tough one because in general, it is uncomfortable to talk about certain
Yeah.
parts of the body. And but you're doing that. And I think that's really, really helpful to so many people.
Well, yeah, I mean, and you saw hundreds of people the past couple of days in Washington, D.C., younger people fighting for themselves, their families, and that's the way that it spreads. It's just this awareness. We need to somehow break through and have that awareness around early onset and get some answers.
When you started, when you realized that you were struggling with mental health and you decided to form Man Up to Cancer, did you have, was it a slow growth of the organization, or did you find that once you put it out there, there was an avalanche of men that wanted to have a place to go, a safe spot, basically? Can you talk about that?
Yeah, thank you. And I'll take you back a little bit. We are definitely going to run over on time, but you said that's okay. If people have to run, we understand, but I hope you stick around. Real quickly on the origin of Man Up to Cancer was, I mentioned before about how I got out of my pit by, getting over this guy barrier of accepting help, first of all,
Mhm.
and then getting that help. And as I went out there and went to counseling and groups and met people online and Colon Town and Fight CRC and other groups, everywhere I went I call it Cancerland, everywhere I went in Cancerland, in the advocacy spaces and in the support spaces, the people giving those services and accessing those services were at least 75% women in almost all those spaces that I saw.
Mhm.
And one of two things was true. Either I was just, and at first I thought this, like that I was weak and most guys just have it figured out and they don't need help. Or the second thing, which is there's thousands of guys like me who are struggling with the emotional impact of a cancer diagnosis, but they're taught not to seek help, that they're conditioned to that it's a weak thing to go out there and ask for help. They think they have to do it all on their own. And so it just dawned on me that it wasn't that men don't need help. It was that they're not comfortable accessing the current spaces. So why not build a community for men by men?
Mm.
Because it acknowledges that a lot of men going through cancer don't want to be vulnerable in a co-ed space.
Right.
They don't want they don't want to share with women about all, their inner feelings and what they're going through. That's very emasculating for a lot of men, even in 2024, despite what some people sometimes want to believe about how we should evolve. But like it's true, like that is just a trait, and this is shown by science, by the way, not just lived experience. Um, so it's just acknowledging, like I said, I just want to create a space, a support community for men by men, where men can just let down their guard and share without that discomfort of being in a co-ed environment or in a place that's women led, because there just weren't that many outlets for that. And that's really why Oh, and then I really focused on, I dug into the science behind isolation, because what I was seeing is that men are isolating more than women when going through this. And that is absolutely true, with the literature. And when people isolate going through cancer, they have higher rates of mental health problems, depression, anxiety, substance abuse, higher rates of broken relationships, and they have worse medical outcomes. So from the beginning, it wasn't me just saying like, "Hey, we got to get together, like go through this together." Like, I mean, that's a great thing, but there's practical guidance behind it. And a lot of guys are practically minded. They want to know like, how is this going to help my outcome? Like, what are the nuts and bolts of this? Um, and when I tell them those three things, it hits. Like, if you're isolating, you're going to probably have a worse medical outcome. They're like, okay, how do I avoid isolation, right? And so that was really the origin of it. And to your question around, do they share? Like, boy, do they get vulnerable? I mean, people have asked me, they're like, do you really think guys are going to open up about their cancer journey and what they're feeling and all that other stuff? And I'm like, once you give them the right framework, which I believe Man Up to Cancer offers, they don't stop. Like our engagement. So in our Facebook group where we have more than 2,500 members,
Wow.
we have higher engagement than 95% of the groups on Facebook.
Mm.
When someone comes on there and says, "Hey, having a scan next week, I'm feeling really anxious," there's usually 20 plus responses from like, "Yeah, I get that, man. I'm going through that. I scan in a month. I'm really nervous." Um, Even in the middle of the night, if one of our members like says like, "Hey, I'm spinning out. Like, I need someone to talk to," usually there's a bunch of people like, "Call me anytime." And this takes the pressure off their relationships for sure. Like, you don't want to be talking to your spouse about all your emotional burden going through this. You don't necessarily want to be finding trusted people that you can do that with is rare. So that happens in our space. And then on the growth, um, you know, I envision this as like a call to action because my background is in content. So I wanted to write about it, podcast, website, all this stuff. I knew I wanted to do a Facebook group, but I didn't know how big it would get. And then this guy named Joe Bullock came along. Oh boy. I think Joe might be on this call, hopefully. So Joe Bullock, stage 3B CRC survivor from Durham, North Carolina, came aboard day one and said, I'm all in. This is what I want to do. I want to help other men going through it. And he had some connections on Facebook, and he's like, "Can I invite some of my friends that I know?" And I'm like, "Sure." And then within the first couple of weeks, we had a couple hundred members. Like it was crazy. And since then, it's been very organic growth. Um, it's mostly word of mouth. And we do have relationships with a lot of community oncology practices and some NCI centers where they're letting their patients know about us. Um, so where we are right now, is we have that Facebook group, which is kind of the core of our community. 2,500 men from across North America and Canada and some other spots around the world. These are male cancer patients, survivors, and a handful of men who are caregiving for a partner or spouse with cancer. And it's all different types of cancer. And we have ages 18 through 80 plus in our community. So it's a pan cancer movement. We do have a lot of CRC guys in there because that's me and Joe, that's our background. But we have probably 50 plus cancer types represented. Excuse me. And I just wanted to hit quick on our three programs. So we do an in-person retreat, the Gathering of Wolves Men's Cancer Retreat. We're going to have our third one this year. We're probably going to be close to 200 attendees
Wow.
this fall in September. We do a chemo care backpack program. So we're sending 20 to 30 backpacks a month to members of our community who are going through chemo or other treatment or surgery. And then the third thing is our local chapters. So we have shout out to Don Helgeson, our chapter coordinator. We have more than 40 local chapters that have sprung up across North America mostly. And that allows our guys to get together locally for a ball game or a movie or a dinner. That in-person support is invaluable to have other guys that are walking the same road and to be able to get together. And we also do a bunch of Zooms. So we have a biweekly Zoom for our whole organization, and we have local Zooms for our chapters. when I founded this in like basically January 1st, 2020, I had never heard of Zoom, to be honest with you. And we had to become experts in Zoom real quickly because not only were the people in our community isolated from cancer, then they were isolated by the pandemic.
Right.
And I just have to say something else real quick about the support. Um, we have a very loving, brave group of men who are willing to support one another and to ask for help. And we say, I love you a lot, and we mean it. When we're together, we hug each other like relentlessly. Like we very much shatter the stereotypes of a kind of the macho guys. I mean, and we have guys from all backgrounds, all types of guys you can think of. We have a pretty thriving group of queer, of gay men in our community. And it's all love, right? It's all unconditional love and support. Once you know another guy who's going through this, the walls kind of come down. And my point is, there are some men who get cancer who come into our community who have never heard a friend say, I love you, or who've never had someone hug them, in that way as a brother, as a friend. And I'm very, very proud of our guys for being role models and for normalizing that. Um, I want to shout out three guys briefly. Brandon Martin is in Denver, Colorado, stage 4 colorectal cancer. He is living his best life with an ostomy. He's created an ostomy awareness group in Colorado. And he's also sharing his story as a gay man facing CRC, which is incredibly impactful. Jason Manouge in Kingston, Ontario, young onset CRC in his 30s, stage 4, advancing pretty rapidly, has really advocated for others. He does tons of content where he shares about what he's been going through, creating tons of awareness. Again, normalizing this for men to hear and see, and he's now sharing openly about his end of life as he faces that. So love to Jason. And then lastly, Danny Riggs in Houston, Texas, male breast cancer. Men get breast cancer too. And follow him on Breast Cancer Dude on Instagram. When other men with breast cancer find Danny and listen to him talk and can share that bond with him, it is like water being provided to someone who's going through the desert. Because it is so isolating and the stigma is so intense. So shout out to Danny for the work he's doing. Sometimes just listening to another man going through cancer or reading what they write or just having that engagement can make a huge difference in a guy's life.
Trevor, thank you so much. I've learned so much. I learned a lot about you again over the years, reading your story, and I'm just really grateful. And I'm also grateful to our audience for being here and listening. And again, the purpose of our advocacy chats is to provide education on healthcare policy and any issues related to patient care. And each of us, when we leave these advocacy chats, I hope that you go out and be an advocate. The videos are going to be available on COA's Facebook page. Trevor, I did ask him in advance. He's willing to share all his slides. And I'm the type of cancer survivor that I was super, super, super private about anything personal, but I'm so grateful for cancer survivors like you that are so open about your stories because it does teach everyone. Can we also go to your slide with your contact information, Trevor?
Yeah, but can I take 1 minute
Of
for
course.
practitioners? So I have a message to all the practitioners out there. If you're wondering how can you help the men, like your male patients, just some quick advice. So understand that male patients are more likely to isolate. They are more likely to refuse mental health care or to not follow through with it, or not follow through with a referral. So please, they may need more encouragement from like a practical perspective. Just say, look, if you isolate, these are the consequences. If you want to be here for your loved ones, your mental health needs to be just as important as your physical health. This is huge for men. Like they need to be pushed sometimes a little harder than women for those mental health supports. So I'd really to encourage you to do that and encourage them to engage with communities. It doesn't have to be Man Up to Cancer, but isolating is not an option. So we have postcards available at many community practices and NCI centers. If you would like some, please reach out to me. But please, I hope you remember this conversation when you're thinking about your male community. Thank you.
Thank you, Trevor. And we just have one question. It says, does Trevor know how much his Wolf brothers love and respect him? Signed, a Wolf brother named Brian. Great lunch and advocacy lunch. Thank you, Trevor.
Oh man, thank you,
so much
Brian.
for being here. We have one last slide. Drew, can you advance a slide, please? Thank you. Okay, one more save the date, and then another slide. I should have said 2 slides. Thank you. Please join us next month where we'll have Nick Ferrero as our managing director, sharing lots of updates on what's going on with COA and some news on our upcoming Hill Day. Thank you again, Trevor, and to all our audience for sticking around. We appreciate you so much. Enjoy the rest of your day.
Thank you, Rose.
Thank you.